You know how you sometimes hear about those incredible luxury cruises, like the kind of trip you dream about?
Yeah, definitely.
Well, what happens when that dream takes a decidedly unpleasant turn? You actually flagged this news item for us, and it details a real-world bummer. A significant norovirus outbreak hit the Cunard Cruise Line's Queen Mary 2.
That's right. Yeah, this CBS report you shared, it paints quite a picture, doesn't it? A month-long transatlantic and Caribbean voyage that was, well, significantly disrupted by a widespread illness. Affected a lot of people, passengers and crew.
Right.
So our goal in this deep dive is really to unpack this situation for you, figure out the timeline, the sheer scale of it, and what this tells us about norovirus and maybe the unique environment of cruise travel itself.
Okay, so let's get into the timeline then, because this wasn't just a quick weekend getaway, right? This was a proper journey. The Queen Mary 2 set off from Southampton back on March 8th,
March 8th.
heading across the Atlantic to New York, then down to the Caribbean places like St. Thomas, Barbados mentioned before turning around to head back to the UK. That's a long time to be at sea.
It really is a lengthy voyage, and, well, that extended period inherently increases the chances for any kind of contagious illness to spread.
Yeah, makes sense.
The report notes the outbreak was actually reported to the CDC's vessel sanitation program around March 18th. So that's about 10 days into that initial leg of the trip.
Wow, 10 days in. And the numbers involved, they're pretty eye-opening. We're talking about 224 passengers out of just over 2,500 getting sick,
Yeah.
and 17 crew members, too, out of about 1,200. That's a substantial chunk of people on board dealing with what sounds like a pretty miserable experience.
Absolutely.
I mean, can you imagine you're on this luxury liner, supposed to be having the time of your life, and you're stuck in your cabin with a stomach bug? Ugh.
Exactly. And the main symptoms reported were diarrhea and vomiting,
Mm.
which, as you probably know, are the classic signs of a norovirus infection.
Dreaded stomach bug.
That's the one. What's kind of intriguing here is that this happened on a ship specifically called out as a luxury cruise ship. It almost makes you think, maybe subconsciously, that a high-end environment would somehow be, I don't know, immune.
Right. Like, surely not here.
But as this shows, that's clearly not the case. Viruses don't really care about the price tag.
No kidding. You pay all that money expecting, top-notch comfort and care, and bam, highly contagious illness sweeps through. So let's talk a bit more about this norovirus. We hear about it, but what makes it so effective at causing these kinds of outbreaks?
Well, like you said, it's often called the stomach bug, and for good reason. What makes it so easily transmissible is actually quite remarkable. They can spread through contaminated food or water, obviously.
Like buffets or shared water dispensers.
Exactly. That's a clear pathway on a ship. But it also spreads incredibly easily just through contact with contaminated surfaces. Think about it, handrails, doorknobs, elevator buttons, even cutlery maybe.
Oh.
And then if someone touches their mouth before washing their hands,
Mm.
often that's all it takes. And get this, the infectious dose is really low. It doesn't take many virus particles at all to actually make someone sick.
Whoa, that low infectious dose.
Yeah,
That really paints a picture of how quickly it can just take hold, especially when everyone's in such close quarters.
precisely.
Now, here's a detail from the report that really stood out to me. While the worst of the symptoms, the vomiting and diarrhea, might only last like a day or maybe 3 days,
Uh-huh.
people can continue to shed the virus and transmit it for 2 weeks or even longer after they feel completely better. That seems like a surprisingly long window.
It is a significant period, yeah. And that's a really key point for you, the listener, to grasp. Someone might feel totally recovered, right? Back to walking around the ship, going to shows, eating in the dining room.
Yeah, feeling fine.
Yet they could still be contagious for quite some time. This prolonged transmissibility makes containing these outbreaks incredibly challenging. People might not even realize there's still a risk factor.
That really highlights the difficulty for the crew, doesn't it? Trying to manage this. It's not like you can just keep everyone locked down until they feel better if they're still spreading it.
Not at all.
Speaking of the crew, the report mentions the CDC's vessel sanitation program. What exactly is their role in something like this?
So the Vessel Sanitation Program, or VSP, it's a public health initiative run by the CDC. It specifically monitors and inspects cruise ships that operate in U.S. waters.
Okay.
Their main goal is to try and prevent and control the introduction and spread of gastrointestinal illnesses, like norovirus. So when an outbreak of this size happens, the cruise line has to report it to the VSP.
Ah, okay. Mandatory reporting.
Yeah. And then the CDC provides guidance on what control measures need to be put in place.
And it sounds like the Queen Mary 2 crew did follow those protocols. The report mentions, increased cleaning and disinfection, which I imagine would be happening like constantly.
Nonstop, probably.
Plus testing to actually confirm it was norovirus and isolating passengers and crew who were showing symptoms. Those seem like the standard playbook moves in this kind of situation, right?
They are. Those are the established and, frankly, necessary steps. Enhanced cleaning, really focusing on those high-touch areas we talked about, handrails, buttons, counters, that's crucial.
Gotta be.
Isolating the sick people helps break that chain of transmission as much as you possibly can in such a confined environment. And yeah, testing helps confirm the diagnosis, although, honestly, in most of these acute gastroenteritis outbreaks on cruise ships, it almost always turns out to be norovirus. It's the usual suspect.
Right. But what's really interesting and maybe a bit concerning if you're someone who enjoys cruises is that this doesn't seem to be a one-off event. The article points out that at least 9 cruise ships have reported similar outbreaks just since the start of 2025. And that includes some really big names in the industry, like Holland America and Princess Cruises.
Yeah, that's a crucial point to recognize. It's not just this one ship.
So this isn't just an isolated incident on the fancy Queen Mary 2. It seems to be like a broader challenge for the whole industry.
I think that's fair to say. Despite all the sanitation protocols and, best efforts, the very nature of a cruise ship, the close proximity of so many people sharing dining halls, pools, theaters, living spaces, it just creates an environment where highly contagious viruses like norovirus can spread pretty easily.
Yeah, it's almost like a perfect storm scenario.
It kind of is. It definitely underscores a persistent public health challenge within the cruise industry, for sure.
And when you look, again, at that itinerary for the Queen Mary 2, starting in the UK, then across to New York, then down to various Caribbean islands like St. Thomas and Barbados, and then eventually back, you realize the potential for this to have wider implications. It's not just contained on the ship, is it?
Exactly right. That itinerary really highlights how interconnected global travel is. It's not just about the virus spreading among those on board. There's also the potential, however small, for it to be introduced to communities at the different ports of call.
Oh, right, when people get off the ship.
Yeah, or even carry back to the origin point when the cruise ends. It really shows how a seemingly localized outbreak can quickly become part of a much larger international picture.
Now, zooming out even further, the report also mentions there was a general increase in norovirus cases reported in the U.S. towards the end of last year. Is there likely a connection between that broader trend on land and what happened on the Queen Mary 2, or is that just, coincidence?
Oh, it's highly likely they're connected. Norovirus tends to follow a seasonal pattern. Activity typically picks up during the late fall and winter months, certainly in the Northern Hemisphere.
Okay, so it's peak season, sort of.
Pretty much. So if there's a general rise in cases circulating on land, that definitely increases the probability of the virus being introduced onto a cruise ship, maybe by a passenger boarding or even a crew member.
Makes sense. Someone brings it aboard unknowingly.
Exactly. And then once it's on board, the conditions we've been talking about, the close quarters, shared facilities, they just facilitate its rapid spread, its amplification.
So to kind of wrap this up for you, the listener, what we've really uncovered here is that, yes, a pretty significant norovirus outbreak happened on this month-long luxury cruise. It hit a large number of people.
Yeah, quite a few.
And this really just underscores how incredibly contagious norovirus is and the considerable challenges involved in trying to contain it, especially in that unique, closed environment of a cruise ship. And importantly, like we said, this isn't some freak event. It's actually part of a pattern of outbreaks we've seen across different cruise lines recently.
Precisely. The speed at which norovirus can spread,
Yeah.
and especially that surprisingly long period where someone can still transmit it after they feel better, those are really critical things to understand.
That post-symptomatic spread is key.
It really is. The cruise ship environment, while it offers this distinctive travel experience, it just inherently presents these ongoing challenges for preventing and effectively managing outbreaks of infectious diseases. It's just the reality of putting that many people together.
It really makes you think, doesn't it? Considering just how easily this virus spreads, and especially that potential for extended, almost invisible transmission after someone feels okay, what does this tell you about managing public health in any kind of shared environment, really, and not just cruise ships.
Good question.
Like what other seemingly self-contained spaces, maybe dorms or conference centers or even workplaces might face similar vulnerabilities? And what broader lessons can we maybe take away from this specific incident for how we think about and handle contagious illnesses in our daily lives, even, after the obvious symptoms seem to have passed? It's
Yeah.
definitely something worth mulling over.